Hey, doctors of chiropractic and doctors of physical therapy and anybody looking to optimize human function. Quantum Shift Technique is the thing that's missing from your practice that's going to help you bring your services to the next level. Why is this important? Because it balances the brain, and the brain is the first thing to determine all of the physical function. How it works is it resets the hemisphericity, so it balances the left and right brains in order to allow for the body to balance itself out. And it's done through muscle stretching and specific joint articulation movement, stuff like that. Not to get too nerdy, but if you want to raise your clinic status to the next level, and if you want to support the people you're serving to the next level, I will highly encourage you, if not urge you, to get trained by Dr. Turner in Quantum Shift Technique. You're not gonna be disappointed, and it's gonna really be the game changer for you. So check it out, Quantum Shift Technique.
Hi, I'm Dr. Michael Winters in Paducah, Kentucky. I'm a 42-year practitioner and one of the QNRT master practitioners. And I want to talk with you today about Quantum Shift Technique. So why take it? We're all, as chiropractors, we've all learned to evaluate spinal nerve stress. But what if the stress is at the level of the brain? If the stress is at the level of the brain, then it's going to affect muscle tone, right versus left, and it's going to alter the autonomic nervous system. So in Quantum Shift Technique, we're going to see how to evaluate left and right brain through posture, through muscle testing, and how to make a correction, and then all the physiological effects from that correction. We're also going to know how to get the brain integrated with the core muscles and the core of the body. And it's incredibly valuable in that way for chiropractors because, again, if the nerve stress is above the spine in the brain, we're not going to be as effective with a spinal adjustment by itself. And so all you're doing here is learning another layer of nerve stress, but a layer of nerve stress which is very powerful and fits in with the QNRT work and everything else that I do. And combining all these different techniques that I've learned from Dr. Turner, we've seen over the last 7 years, we've seen patients from around 28 states of the country where they've drove or flown in to get care for us. And so you will make yourself a distinguished practitioner in your area if you take this seminar. No questions, period. And so I'm highly recommending that you do so. Register early. I'm sure it may sell out. Quantum Shift Technique, it's a great thing for you to do. I'm Dr. Michael Winters, Winters Wellness, Chiropractic Redefined.
Hey, aloha gang, Dr. Russ Rosen here. Welcome to Dr. Rosen Interviews the Greats. And we have one of the all-time greats with us here today. That's Dr. John Turner. Dr. Turner, welcome aboard.
Thank you so much for being here.
Yeah, I'm really excited to be able to have this discussion with you. So I'm honored to call Dr. Turner a friend, and he's certainly one of my great mentors. And especially when it comes to this concept of brain-based health and wellness, chiropractic, how do we pull this off? The doctors that I coach, and I coach quite a few doctors that do the work that he teaches, by far across the boards, always have the greatest stories about the best results of anything else I have ever worked with. So, I don't say that lightly, and if you've heard other interviews, I always say that, but it's true. So I really wanted to welcome you aboard, and I wanted to talk with you specifically about this hot new concept or trend, which is called brain-based wellness. Talk to me, what's up?
Yeah, I mean, brain-based wellness is the idea hit me when I was probably doing chiropractic for almost 20 years. And then totally disconnected that the brain influences the rest of the body. And I was really focused just on the spine only. And so as I started getting clients that had disorders that were outside of the chiropractic realm, things like anxiety, things like depression, things like sleep disturbances, learning disabilities, these kind of conditions were things like, how can I help these problems? And so in the process of working with clients, I started noticing that there were certain patterns that clients had, and they were certain postural distortions. And as I looked at those postural distortions, I've been working on those for years. giving them exercises, working on certain spinal segments, and trying to influence that postural imbalance. And when I finally figured that if I could affect the brain, that those postural distortions went away. I mean, almost immediately. From the time they sit in the chair to the time they stand up, there's improvement right at that point. And then the funny thing was that clients would come back and say, "Hey, doc, you remember that sleep problem I had? Hey, that's gotten better." Or, I've been talking about how I was anxious. And, after the last couple of treatments, that anxiety that I had has improved. I'm not near as anxious. I'm not near as worried. And so I started saying to myself, like, something must be up. I'm doing something different from my previous 20 years in practice, which I thought I was effective in helping people with pain and helping people with certain mechanical problems, which I was, which probably a lot of people out there listening to this also are good as well. But I wanted to look at that realm where no one touched. What else could I help in being a chiropractor that I never thought I could? And that's when I looked at the brain.
Yeah, and we're not just talking about a rebranding here, right? I get this all the time. Oh, we're going to call it, well, it's brain-based, but I'm going to do the same thing I used to do. To the point that, so not only have I taken your courses, but
Right,
I've flown out there, stayed there, have a fair amount of work done with you
right.
and by you, and I felt the changes myself. But your sign at your office says Neck and Back Pain Center.
No, my sign does not say neck and pain center.
What does yours say?
Mine says brain-based brain wellness.
Yeah.
Yeah,
Brain wellness. It's not just a rebranding. It's yes, we're having a different discussion. It opens up very different discussions with people when we're talking about the brain, but also the style of work that we're doing changes dramatically because we recognize that if we understand the concept of a subluxation, that isn't a bone out of place, is a state of disafferentation, disefferentation. What is in the middle between disafferentation and disefferentation is the brain. So yes, no matter what you're doing, if you're doing a neurologic input, of course, you're affecting the brain. But we're not just talking about that. We're actually talking about being able to monitor specifically what is going on in the brain, how it's affecting the rest of the system, make appropriate changes, and then being able to see that that actually occurred. True story?
true story. And here's the thing. Our degree as a chiropractor puts us in the best position to be able to apply that type of care to our clients. Again, what did I miss for 20 years? For 20 years, I was just a darn good chiropractor that could help you with pain, could help you with a sports injury, could help you recover from some type of injury. What I totally missed that I was capable of doing so much more. And once I got the concept that the brain is where you start, and the result of the brain imbalances are then spinal distortions, postural distortions, organ dysfunctions, things like heartburn, things like bladder incontinency. All these are related to the fact that the brain has to be in balance. And I can tell within the first 10 seconds what imbalance am I going to be dealing with on that client as soon as I look at them from a postural standpoint.
Yeah.
And that has then switched that now we become the expert, which has always been my goal. As a chiropractor, we need to be experts. And we can be experts in a lot of things, but if we just get locked into the experts of postural health, which is not a bad thing, or we become an expert in mechanical issues, which is again not a bad thing, but what about all the other health problems? And when a client comes in, there are a host of symptoms that they're not even going to tell you because they think that you can help them with that. And one of the things we do in our evaluation, I sit down and I go over, okay, here's a right brain imbalance. Here are all the symptoms that you're prone to probably have. And I have every client say, I have that one, I have that one, I have that one, I have that one. And there's nothing in my case history that says they have that problem at all from the initial exam.
Yeah.
And from that standpoint, that client thinks, this guy knows a little bit more than someone else because he's suggesting that if my brain were in better health and balance, that I might not have those type of symptoms. And I might be better in the ability of my memory and my thinking and my cognitive function.
Yeah.
And from there, then we become a much more broader yet specialized practitioner that only we can do because we're using joints of the body. We're using, and now we're talking about something which we kind of miss, and that's the retooling of my chiropractic. And one of the instrumental things for me that retooled my thinking was reading a book called Functional Neurology for Manual Practitioners by Randy Beck. And he is a functional neurologist, and I learned functional neurology by reading that book. I really didn't even want to go to a seminar because I wanted to learn and then I wanted to apply it. And then I took the techniques that I knew, and we call this quantum shift technique because we believe that we can make a quantum shift in the brain, which then makes that shift in the body and the neurology, that we can affect people's symptoms and problems in such a way that they get better. And our technique is called Quantum Shift Technique. The beauty aspect of Quantum Shift Technique, if you're a chiropractor, you can do this technique without relearning a new technique procedure. In other words, you can use the techniques that you already know. We just teach you how to direct that so that you know you're doing the proper thing. In other words, just as much as you can influence the brain and make it more balanced, guess what else you can do? You can also throw it out of balance by doing something on the wrong side of the body in the wrong manner. There may be a fixation or subluxation on that side, but it's going to affect the brain in the wrong manner. So we gear our technique that everything we're doing is applying to balance out the brain.
Yeah, and the thing is, we as chiropractors give a lot of lip service. The brain controls and coordinates everything. If you're getting proper nerve supply, blah, blah, blah. And then we just focus on the spine or we focus on the joint,
Right.
right? Versus just flipping that around and really looking through the lens of the brain. It doesn't mean you're not going to do these things. These things are going to, you'll still do what you're doing with the
Right.
neurologic input into the brain, but you're going to start looking through the lens of the brain. And in QST, it's one of these things that I love about this technique is how simple it is to learn. This isn't a miserable thing to learn. This is really, really
No.
simple and easy to
Right.
learn. But all of a sudden, it's like first time you looked at an X-ray, black is white, and white is gray, and
Right.
you're looking through the perspective of the brain, and everything changes. Everything changes. So if I've got somebody that, let's just say, they're like this, and I'm doing all this work to try and get them to go like that, and I just look through the lens of, I wonder if the brain is what's causing that. And if this particular case, it is the brain that's causing it, I can do this to them and that to them forever. It's never going to resolve it. But if I can go in and just shift what's going on in the brain, the system will naturally reset itself because it's no longer in that state of defense physiology. Yes?
Absolutely correct. I mean, we know that, right side balance, left side balance has different manifestations as far as symptoms and distortions. We also know that everything in your brain flows from right to left. We also know that the right brain, if it's out of function, is going to affect your posture more than the left brain. And so if we just take our principles and say, well, I want to apply an adjustment, but this adjustment I'm going to apply has to be on the correct side. It can't be on the wrong side because I'm going to make that distortion worse.
Sure.
Or I might even look at it and say, well, that pain's in the shoulder, but what if I stretch the hamstring on the same side, which affects the brain on the right side, and they stand up and their shoulders level and their pain is gone because I never really had to apply a direct technique to the painful area. What I had to apply is the right technique to change the brain function. And from that perspective, that's where you say, you put on new glasses and you see things through a different filter. The filter is no longer that narrow little filter that we saw before, but a much more broader filter. And that says, let's start with the brain first and let's resolve that. Then, if that shoulder maybe needs a manipulation of some sort, well, we can apply that because we did everything to affect the brain. We now see the posture's better, but perhaps maybe the joint needs some mobilization or some stretching. We can do that. We can reset the muscles. We can reset the nervous system connection between the nerve and the muscles and the nerve and the joints. All those still apply. We're just broadening our education in chiropractic to a much higher level.
Yeah, and my experience is by learning this technique, which again, for those of you who've been through some of the clinical neurology courses, which are wonderful,
They're wonderful, yeah.
but my experience is, man, it's like a PhD. It's a lot of work. This particular work is so simple to learn. It is so incredibly powerful. My experience of this, and this is just my experience, is when it needs QST, when the brain needs QST, when there's this particular imbalance going on. And I know a lot of techniques. I'm a technique freak. Once I learned to see that, I then went and looked to any of my other techniques, shift that. And the answer is zero. I don't mean like a little, I mean, it doesn't at all.
Right.
Nothing else I've done, and I do a lot of different things, affects that. So if you've got somebody and they've got these challenges and you're working on them and working on them and working on them, but it's caused by this over here. If you finally come in and help reset this, all of a sudden everything else you do will start to work better. Again, it's not saying get rid of everything you do. It's simply saying start to look through a different lens, change the discussion. Do we want to rebrand? I think we do.
Do.
Unfortunately, we've got negative brand equity out there. We've got so many chiropractors getting out of school either thinking subluxation is a historical term that is something to be embarrassed about, or they think it's a bone out of place, which it really isn't. Because if you really understand what a subluxation is, then you're already thinking this way and having this conversation. But for most of us, it's not true. So for most people out there, they're seeing a chiropractor, they're thinking of neck pain, back pain, headaches. And when you're no longer in that herd, seahorse, sawhorse, sound a lot alike, but they're really different. When they
Right.
get that you're a seahorse and you open the conversation through the lens of the brain, all of a sudden there's a whole world that opens for you. Let me ask you this question right now. Percentages of people with depression, anxiety, any of those kinds of things now, right now, higher or lower than a decade ago?
Extremely higher.
Exponentially higher. We know it's an epidemic. If you've been watching our
Over 90% of your clients coming in are suffering from those conditions
yeah,
to some level. And add to that, the third thing, sleep disturbances. Once
exactly.
I add sleep disturbances, I'm 99.9%.
Right. So the question is, if they came in with going on, do they also have these other things? Do they also have organic function? Do they? Yes, of course they do. And you definitely, with all of what you teach, you address, it's such a complete program. It addresses everything with your QNRT and the nutrition and blah, blah, blah. But just starting through the lens with the QST and being able to just understand what happens when the brain is balanced, when it's not, when there's hemisphericity or not. I can promise you the doctors that that I coach that have gone through it, and myself, your entire world changes, your discussion changes, your results change, your internal referrals change. I mean, all of it changes. So tell us a little bit about there's a seminar coming up on QST. I am telling all of you, I recommend you go to it. You don't need to email me and ask. I'm saying go to this seminar. It's a life changer. It really is.
Yeah, so the seminar is a 14-hour seminar, and we do that over a weekend. We really believe by, Monday morning, you can start implementing the QSC principles and start working with clients, doing your normal techniques, and maybe modifying a few different things a little different in your practice. But the hard thing is that, when we are doing a certain method and we have a busy practice, what you don't want to do is come in and completely upset the apple cart, right? But what we do want to come in is do a few things differently so that we get changes and we get results. And I think, my mentor from a while back he always said results is what basically keeps your practice going. And my goal is to get results and get them as quick as possible because I know someone else and they know someone else who needs those results. I don't think that I have marketed my practice for any type of patient in the last 20 years. And yet I have a waiting list practice. Why do I have a waiting list practice? Not because I'm a marketing, skill person, or not that I'm a great communicator. What I am good at communicating is what problem they're having and what it's related to and how we can resolve that. And I go through the method and I show them that I can do that. And from that standpoint, they get results and they refer other people who they also want for results. So, the QST seminar is again, it's a principle that we can learn. We can certainly go to a lot of the functional neurology classes, and they're all wonderful, and you can learn a lot of great information. But we take that and say, okay, for a busy practitioner, we can teach you in a weekend, and you can implement a lot of those concepts without a lot of study, and you can learn this fairly easy. And we see practitioners, and when I started this, I just took advanced practitioners that I taught in the QNRT system, which is a method of basically resetting the brain through emotional trauma. And I taught this in 6 hours. And it has expanded to be more than that, and we have a lot more information, a lot more help to basically target certain type of conditions. But it's now moved into a more complete seminar that we feel that you can learn this, you can do this, not put a lot of study into it, and you can immediately start using it on Monday morning.
And immediately see results. And I mean when they stand up.
When they stand up. And that's the one thing our practitioners say, is that they have never used anything that has made such dramatic changes in the posture. And once someone says that, if you make dramatic changes in the posture, you have to realize what had to happen. You didn't change anything, as you said, in that joint. You didn't change anything in those specific back muscles. What you did is create your brain to fire properly. So all of a sudden, instead of the stretch of the flexors of the body being tight, they relax, and that opens up your chest. Instead of the extensors on your back being lax, they tighten up and they pull your shoulders up. And all of a sudden, that client is standing up tall. Their forward weight bearing is greatly improved because their brain is firing properly. And that was my aha moment, was the brain has to fire properly. It's not that I have to push this bone in place to fix that issue, but the side benefit of the brain firing properly was not only their posture improved, but then, as we said, other conditions, other organ dysfunctions, things that they never thought would ever be helped by anything, improved.
Absolutely.
Yeah.
And how long does if I'm with a patient, how long does it take me to do it once I know how to do the work?
You can do this anywhere between 2 and 10 minutes. You could take a portion of this, and if you had a very high volume practice, you could take a portion of this and utilize it for that visit. And you will make a change, and your adjusting procedures will hold better and they'll improve better with that. If you do longer treatment, you could easily do 10 to 15 minutes of this. If you wanted to reset, certain injuries and muscular dysfunction and knee problems and those type of things, you can take your visit up. The key is, though, if your time is worth your value, so you can charge differently when you do this technique, depending on what you're going to do.
Yeah.
If you're going to do other extensive works, you can upcharge this visit because now your time is worth more. If you're going to do a basic visit, you have a standard widget that you charge that fee. And you can do this by your hand. We use a few things that most people have. Any type of laser will help to basically initiate and facilitate the improvement in the brain. We do other simple things, very non-expensive tools that you can utilize and put in your practice and utilize. And so you're not going to be in debt when you come out of the seminar that you have to buy expensive equipment.
Yeah, absolutely. And just along those lines, so I coach some doctors that are super high volume. And if you're spending, 45 seconds to a minute, 2 minutes person, okay, so there are things that you can do. You're going to look through the lens and you're going to say, this person has that going on. In these 2 minutes, I can do this. You can also set up extended visits. And on those
Correct.
extended visits, this is where we go deeper. We deal with what's going on with the brain. We charge appropriately. There's a lot of different ways to work it. But step one is start to understand how to look through the lens and see how the brain really is affecting the people, and how the work you're doing is is or is not affecting the brain. That's the big thing. And once you recognize that maybe some of that isn't affecting the brain as I might have thought or hoped, but now I have the ability to do so, you figure out how to integrate that into your practice, and the results speak for themselves. The internal referrals speak for themselves. It just is the way it is.
That is it. And we go back to our original conversation. Why is brain-based wellness hot? And like you said, it's not just hot because you think that you're going to say that you're doing something brain-based wellness, is that you actually can do something that can affect the brain. I certainly, I had a sign out in front of my office, which is a fairly busy road. And obviously I had the standard chiropractor. And I can tell you in the 20 years of practice, I maybe got 2 clients off that sign. The moment that I put brain-based wellness, I can tell you, I literally get 4 or 5 people every month that will just walk into the office and say, what do you do here? We train our staff to go, this is what we do. We have brochures to give them to say, this is why we're different. So the sign itself just tells you that this is a subject that people want to know more about. They're worried. They're worried because they're now dealing with their parents that are now suffering from dementia and suffering from Alzheimer's. And there's nothing that they can find in literature that says, how do we prevent this? What do we do not to have this problem? And we go right back and saying, if you have a balanced brain, your brain does not ever need to show any type of neural decay until you hit your 90s. And that's what the research says. At the present time, and who knows, maybe another 15 years it'll be over 100. But at this point, we shouldn't have any neural decay that occurs in our brain up to the age of 90. And after 90, my hope is if I get there, it's going to be very small.
Yeah.
And so we don't have to go through that as we see our friends and our family go through that. And having a technique that's simple, that uses extensive neurological principles that we break down to make it easy. We can use low force techniques. We can use higher force techniques, depending what you're more comfortable with. There are certain things that may do better with a low force technique, and there may be certain things that may do better with a little bit higher force technique. And we point those things out. But you as a practitioner still can make that decision, and you'll still see the changes that you want to see. And that's why we're just excited by saying is that when we started QST, it was really a side note of my QNRT seminars, which is dealing with the emotional trauma and affecting the brain. And I got the aha moment as I'm a chiropractor and I've missed the boat here. Is I totally missed out that I can do things within my license that can affect the brain in the way that I was trained in school, but I now can apply it in a system. And I can tell you, having a system is a game changer for your practice. Having a system like QST or a system that just like you can have a bad day that day. You can have maybe some stress trauma that occurred, but you can walk in that office and you can follow a system and you can rely on that system and you can rely that system will give results each and every time. So having a system that I can use, that I can follow step 1, step 2, step 3, and follow that system takes all the guesswork out of practicing. And I think from a person who's an early practitioner, they get in practice and are like, okay, well, what do I do? How do I do this? And if you had a system that says, here's the system, follow this system, and you'll find that you'll get 98% of your clients to improve on that system. And then you may apply a few little other technique wizardy type things that will make that little bit of change. But if you have something that you can utilize that makes a major impact each and every time, to me, practice becomes fun. I don't have to overthink things. I don't have to guess. I can explain things. I can talk to clients. And just having that in that method, I think that's the reason why I'm a referral-based practice. I never asked for referrals. I mean, I've been to practice management seminars. They say, okay, you write down, give them a card, and I want you to write down 3 people that you think will benefit from this. I never had to do that. I don't think you should. I think if you get results and you communicate properly, which is what I love about your system. So let's tout what you provide. One of your biggest aspects in practice management is learning how to communicate properly. Yeah. And the reason why you probably love the techniques that we share is because you can communicate to the client in a very succinct manner that makes sense, that the client gets it. We're talking about a client that may, not understand anything more than a sixth grade education. And they have to, how am I going to teach them neurology? I have to break it down to such a level that they can understand. And that's what QST can do. We can demonstrate it. We can do it. They can stand up. They can feel the difference. They can go out and know that they're going to come back later that week and they're going to want to come back.
Yeah. I'll just throw this out. Most of the doctors that I coach, we get them to the place where their patients will say, I don't want to just feel better. I want to get healthy and stay healthy. And I get my doctors are telling me my patients are saying that. And then they whisper to me, I just don't know if I can deliver it. And then those are the doctors that I say, you really got to go check this out. And across the board, most of them start with imposter syndrome. I don't really think I can deliver those goods. I've heard
Right.
I've heard the magical miracles, but I've never really experienced them. And after they start doing this work, they come back and they start having the miracles. Not every once in a while, all the time. They
Yes.
start having them all the time. Why? Because we're not just changing our brand. We're actually having a paradigm shift, a quantum shift, if you will, where we're seeing things from a different perspective. And I want to reiterate, you're not going to throw everything out that you already do.
No.
That would be stupid. You already have great skill set. But once you can look through the lens of the brain first, everything else changes and everything else works because we're doing it at the right time. We're doing it at the right pressure. We're doing it on the right side, right? When we do that and we really look through that lens, the brain changes. And when the brain changes, everything else changes. You are going to be having CE approval for this. Is that true?
That is true. And we'll share a slide. I think we have about, I think I saw about 38, 39 states that I counted that we are going to have CE approval for those 14 hours. So the good news is that if you are of that state and you come to our seminar, you'll at least get those hours. And, you may need to get, your basic law hours and your jurisprudence hours as additional. But from the standpoint is you can definitely knock out those 14 hours from this seminar.
And my opinion is, and I'm looking right at you now. My opinion is if your state doesn't give CE approval for this, so what?
Yeah. So what?
Go to this seminar anyway. It'll
Right.
change your life. It'll change the way you practice. It'll change your certainty. It'll change your results. And again, it is such powerful work. You just got to look through a different lens. And when you do, everything else will change.
Yeah, I appreciate that. And that's definitely so true. And we see that with the people that I train. You see that with the people that you train. We share clients together. You send your clients to say, hey, you need to learn some things to basically be able to deliver that certainty that you can make that change. And I send you clients that they need help in their communication. They need help, basically in getting the message across. And across the board, those clients that work with you, that no doubt they do so much better in practice. And the people you send me, they come back and they're able to deliver and feel confident about working with clients and being able to do that. Listen, healthcare is a hard business. It's not an easy business because, you're on the spot each and every time you're working with clients and you're hoping you can deliver, you want to deliver. That's part of what you're about. But, what's the worst case scenario? You work with a client, you get the call the next day. I'm worse, doc. I'm worse. My pain is worse. When you do QST, that's not going to be the case because you're going to follow all the principles that it takes to get them in a more balanced state. And obviously, from a standpoint, it makes sense. A more balanced brain is a more functional brain. A more balanced brain is a less painful body because everything is now controlled and coordinated. And that's how we learn this in chiropractic. Every cell in your tissue cell has a nerve fiber going to it. We want to communicate with that properly. And that's something we do with QST. What we also do in the QNRT aspect of the seminar, it's a much more extensive program And in that program, we're learning how to identify the specific brain lobe and the specific tissue and finding the emotional stress or trauma that we need to reset and release so that that also changes the brain. So the big aha moment was, as a chiropractor, I can use two methods. I can use one method in the skill set that I already know as a chiropractor, and I can use a new method if I so desire to train in that, where now I can target the brain specifically in functional neurology and make changes without having to adjust a segment or a bone or a joint in the body. We're only working on resetting the brain.
Yeah, literally working on resetting the brain. That is the neural input.
Right.
And the thing I would just throw out about QNRT is it is wickedly scary of how accurate it is. Man,
Yes.
it is so accurate. And then you read what's going on, and then they look at you like they saw a ghost. Like, oh, how did you know that? That's unbelievable. So, yeah, again, for me, I cannot recommend enough that you work with Dr. Turner. And if you want to start with something, again, that I think is very simple and easy to learn that has such a big bang for the buck response, QST is a great place to start.
I agree. Thanks so much.
All right.
All
As
right.
always,
Yeah.
much love and aloha. Bye, gang.